I bet it. Yes. Audio's good now, so we can start? Okay, thank you. Should we just go with audio? I mean, fine. Bob?
Okay, good morning, everyone. I'm going to call this meeting to order. So the January meeting of the El Paso County Public Health Board of Health has been called to order. I'm going to do a member roll call. Start off, Ed Colas, I'm here, you can tell. Doris?
Here.
Dr. Turbush?
Here.
Commissioner Cammie Bremer, I think she's online. Called in. Okay. Commissioner Gonzalez?
Here.
Councilmember Donaldson?
Here.
Dr. Vu?
I'm here.
And General Briggs, I don't know if he's been able to get online or not.
I'm here.
Oh, he is. Oh, congratulations. Thank you. All the way from London. We appreciate you taking the time out of your time away. Well, we're going to look for an approval of the agenda. I need a motion and a second. You had an opportunity to look at that?
I'd like to move approval of the agenda.
Good.
Okay, all in favor?
Aye.
Aye. Okay, sounds like that passed unanimously. Board of Health comments. And I'm going to jump in with these Board of Health comments to start off and take the privilege of going first. To my right is a gentleman who has served as the Board of Health president for several years. Leaves very large shoes for me to fill, and it's not because of the size of his feet, but just because of the amount and quality of work that he's done in this position. I would like to thank Dr. Turbush publicly for all of the work that he's done. He's been the Board of Health president. I think we just spoke for about 4 years. He managed the Board of Health through a very trying time of COVID-19, as well as other things. Numerous resolutions were passed under the leadership of Dr. Turbush. Things that are important to the public health community and things that are very important to our local staff here. Dr. Turbush never missed an opportunity to compliment the staff and how hard they worked here in Colorado Springs and El Paso County to work for the welfare of our community countywide, and that's very much appreciated. He worked very strongly with our public health director, Susan Wieland, who, by the way, for all of you attending, Susan is also attending remotely, and I know that she'll probably have some words to say about Dr. Turbush as well. But he's been very gracious in helping me as a new board member and now into this position. And I'm just very grateful for all that you've done, sir, for the way that you've served the community and the way that you keep the health of this community in that top of mind awareness for yourself and for the rest of us. So thank you, Dr. Turbush. And I'm going to open it up to any other board members that might have something to add.
Well, I'd like to say that one of the important points that Dr. Turbush has always iterated with me is he would always ask the question, what's the worst thing that could happen? And that was kind of a filter that he could use. And so I'll always remember that. And I use that now in my work with the foundation that I work with. And really appreciate all that he's done for the health of our community as our Board of Health leader for all those years. And then I have another Board of Health comment, and want to just congratulate Commissioner Bremer on being elected chair of the county commissioners and wish her well in that new leadership role.
Thank you, Mr. Chair. I do want to thank Dr. Turbush, all the great things he's done for our community. I think I'm the last remaining longest serving
Yes, yes.
now. But so 6 years now, getting to work together and seeing all the work. And I really appreciate our conversations as related, especially to the military and times and all the great knowledge you've learned in the medical field through that as well. So thank you again for all the dedicated hard work and service throughout the years and on the board.
Any other Board of Health comments?
I'd like to jump in here. This is Commissioner Bremer. Ted, you said you started it off very quickly. I've been honored to work with Dr. Turbush. In particular, he always added a different and much needed perspective to the process of our interviewing workers. Your
Yep, we lost you.
He is saying really glowing things about Dr. Turbush.
They sound great, heartfelt.
Okay, thanks. Susan, can we hear you?
Muted.
I know we were having audio difficulties earlier. It might still be carrying on now. While they're working on that, do we have any other comments from Board of Health members that are present?
I also want to thank Dr. Turbush. You've been a mentor to me. Thank you.
Yeah, thanks, Mr. President. Dr. Turbush, you welcomed me very graciously and friendly when I first got to the Board of Health. Then things got a little rocky during the COVID part of our journey, and I still think that's the duty of those of us on the board, is to give you our honest opinions, not to be a bunch of yes men or women. And I look forward to working with you, in the future. And coming up with good policies for the county in a nice, cordial relationship, and I look forward to it. So thank you for your service to the county and what you do here. Thank you.
Okay, it still looks like those who are online, I see a picture of Cammie that's frozen. So one thing that we're going to do, and Dr. Turbush, do you have anything you'd like to add?
I'll be real quick. I think, of course, the quote was, before we go out the door, how can we mess this up? Yeah. but it translates exactly to what you said. And I just wanted to say very quickly is that I'm very humbled, great to have served on as Board of Health President. I joined the Board of Health back in 20. So you're going to have to put up with a little bit longer. My second 5 years in August, I'll still be. Hopefully, good question. What an opportunity to serve. My dad said probably several times, Jim, what are you going to do with all that fancy? This time of president, certainly worked those neurons. Glad I had experience. Quite honest, if I hadn't had a COVID, would have kind of felt left out. Not that a lot of thank yous. First of all, thanks to the other Board of Health members, even those of you remotely can't respond right now. And I learned much from each and every one of you. And going out, a little bit outside the lines, well, not very. I wanted to especially thank Nikki Simmons and Lori Go, and before you, Diana May. And I got to tell you, having a good lawyer at your side keeps you out of a lot of trouble. Doris, I wanted to thank you and for your help and, you know, subbing on some of the, mostly just being there, solid person to bounce ideas off of. We met, well, every month for, you know, the last 4 years, so it's been good to get to know you. Thank you, Deputy Director Deanne Ryberg. You don't get enough, I don't know, screen time. You're back there working quietly and hard and all that, but believe me, I know what you do or have a pretty good idea. And you're stellar. You're a rock star. And your whole team that you direct are rock stars. And if there's anything that I'd like to be remembered for, it is what Ted had mentioned. He cares about stuff. That's the number one thing. Go away with. Thank you, Director Whelan. We've gotten to know each other via email and video call and meetings in your office probably far too much. And I think that during COVID, there was something just about every day, email or phone call or something that was going on. But Director Whelan, I'll call you Susan. Your leadership is outstanding. I've said it before, I'll say it again. All the different right person, right time. Greatest public health emergency of our lives. And I think that's about it. That's a good place to quit. So thank you.
Well, you're very welcome. And we do have a certificate of appreciation. Following certificate is given to Dr. James Turbush on behalf of El Paso County Board of Health and El Paso County Public Health staff for serving as president of the Board of Health from January 21 through December 22. So just the most recent last year. But really, we're thanking you for all 4 years of your service as the president of the Board of Health. And is this something, Michelle, you want to do a photo?
Yes, please.
Okay. All right.
All right, so if we could have everyone on the backdrop.
Okay. And here, quit moving. Here, move this way.
No,
or-
I think. Feel more balanced.
More?
It looks skinny. Gotta make us look.
Yeah. Make him look skinny.
Try.
Thanks, sir. Thank you. Appreciate it.
Okay, the next thing on our agenda is the approval of minutes from our last meeting. You've had an opportunity to go over those?
I move approval of the December 14th, 2022 Board of Health meeting minutes.
I'll go ahead and second.
Okay, all in favor? All in favor, say aye.
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 Any opposed? Okay. Oh, just got a note that City Councilman Tom Strand walked into the room. Want to recognize Mr. Strand. Thank you for being here.
Thank you, Chief.
Okay, the next item on our agenda is public comment for items that aren't on the schedule. Do you have anyone that has come in? Oh, and haven't been made aware of anybody. Well, thank you very much. Anybody online? And I have not been made aware of anybody online that wanted to make any comments.
And Mr. President, I did, if I take 10 seconds, I forgot
Sure.
one thing. I did want to highlight that today was also the kickoff strategic plan meeting for the Regional Opioid Council meeting. I believe it begins at noon in, I believe in this facility here today.
Okay, thank you. All right, next item on our agenda is finance and budget. Now, normally, we have a presentation from the finance staff on the previous month, but the previous month being December takes a little bit more time to get together, so that we have to do the entire year. So we won't have that kind of a presentation this morning, and I hope that you understand why. That'll take place at our next meeting in February. We do have a contract that is up for us. Becca Barnhart with Youth Substance Use Prevention Planner is here to make a presentation regarding a new contract with the Colorado Trust Culmination Grant. Becca, welcome.
Thank you. Is this on? It is. Oh, I can really hear myself. Okay. Good morning, everyone. My name is Becca Barnhart, and I am the Youth Substance Use Prevention Planner with El Paso County Public Health. I oversee Fountain Valley Communities That Care, which is a community-led coalition that works to reduce youth substance use in Fountain, Fort Carson, Widefield, and Security, which is an area collectively referred to as the Fountain Valley. In 2016, El Paso County Public Health received grant funding from the Colorado Department of Public Health and Environment to implement the Communities That Care, or CTC, prevention model in one of our communities. CTC was implemented in the Fountain Valley because of existing partnerships, community readiness, and a desire to impact youth substance misuse in the area. The City of Fountain, which is going to be on the slide here, I hope. There it is. The City of Fountain, which is highlighted in green on the slide, and the surrounding areas already had systems in place to effectively address youth substance use and demonstrated a willingness to implement changes that would help their young people achieve healthy youth outcomes. With the collaborative help of all involved in Fountain Valley CTC over the past 5 years, the Fountain Valley has enhanced its ability and capacity to make sustainable changes and create opportunities to reduce youth substance use and other unhealthy behaviors. Next slide will show some great data. Fountain currently has a population size of 29,495, with nearly 17% being young people ages 10 to 19. The Fountain Valley as a whole has a youth population of 11,070. And next slide, please. Fountain Valley CTC focuses on community-led efforts to improve youth outcomes. The CTC Coalition consists of community members, youth, parents, youth-serving organizations, local libraries, law enforcement, El Paso County Commissioners, thank you, Commissioner Gonzalez, religious organizations, healthcare representatives, and local public health, all of whom are actively engaged in planning and implementing strategies. The CTC prevention model is a 5-phase change process that uses evidence-based approaches to promote healthy youth development, improve youth outcomes, and reduce problem behaviors. For example, to prevent youth substance use, Fountain Valley CTC focuses efforts on increasing safe spaces in the community. Having access to safe spaces in the community is associated with lower risk of substance misuse due to an increased sense of connection to the community, and it also gives young people a safe space to spend their time and energy. In order to be effective, we actively engage youth in our efforts to prevent substance use. Youth input is gathered in numerous ways. However, most widely, we do this through the Coalition's Teen Action Board. Our Teen Action Board consists of young people ages 11 to 18 that are from Widefield School District 3 and Fountain Fort Carson District 8. They provide guidance and insight into how to effectively influence young people in the Fountain Valley. Our Teen Action Board takes pride in their work, and they help to influence their peers and collaborate with their community to create a healthier and safer community for both youth and families. In fact, their work has been nationally recognized, and we're very proud of that. El Paso County Public Health received national recognition at the National Association of Counties Conference for the Teen Action Board's work amplifying youth voice in the community back in 2021. And on the next slide, you'll see that CTC has benefited from 3 funding sources. The initial CTC funding has allowed us to create a solid foundation through community collaboration to address the issues of substance misuse and creating a safer community. Drug-Free Communities, or DFC, builds on the specific foundation by providing funding to enhance our community's ability to address 2 specific substances. The Colorado Trust Grant continues to build on that by allowing us to fund programmatic needs identified by the community and also carry out action items that are created by the coalition that require funding. Each funding source works in conjunction with one another and elevates our level of success in effectively preventing youth substance use in the Fountain Valley. By allowing us to increase community capacity to address youth substance use, CTC funding has helped us to create a solid foundation in the Fountain Valley. In addition to CTC funding, El Paso County Public Health received Drug-Free Communities, which you can see in blue there. DFC funding through the Centers for Disease Control and Prevention in 2021. This funding allows the community to expand on efforts that address youth substance use. Although we have always focused on all substance use prevention and improving mental health among youth, DFC allows us to fund initiatives to effectively reduce the use of 2 substances negatively impacting our youth, taking into consideration Healthy Kids Colorado survey data, and as well as existing prevention efforts already addressing certain substances such as tobacco. The coalition decided to focus its efforts on reducing marijuana and prescription medication use, including fentanyl use. On the next slide, you'll learn about one of our community partners. One of our community partners that has been actively involved in CTC has been the Colorado Trust. The Colorado Trust is an organization committed to advancing the